On the day of surgery, you should fast, which means that you do not eat or drink for at least 6 hours before the surgery. This time period will be discussed with you by my staff or by the hospital staff, and you should receive a phone call on the day before your surgery in relation to the expected time of your surgery, your expected admission time, and also the time after which you should not eat. You should take your normal medications with a sip of water, even if you are fasting. Diabetics do need special advice, and this needs to be discussed with me and perhaps with my anaesthetist. Morning surgery would dictate that diabetics do not take insulin or their normal oral hypoglycemic agents. Oral hypoglycemic agents are those tablets that tend to drop your blood sugar. So if you're having morning surgery, you shouldn't take these in the first thing. If you're having afternoon surgery, you should eat a normal breakfast, and you should take your normal insulin or your normal tablets. Nothing should be taken after that time. You will be dressed and prepared for the operation by the ward staff. This will follow upon checking of your details, upon checking of the type of procedure that you're having, and certain other routine matters that are done by the staff. You will be then taken by a wardsman through to the operating theatre. In the operating theatre, you will be met by the operating theatre staff, who will once again take the same information from you, though to a lesser degree. You will be away from your room for a good deal of time, and even a simple procedure can be associated with a time away from the ward of 2 hours or more. So it's important to tell your relatives to be realistic about time frames. They should go away for at least a couple of hours, although they can of course wait in the hospital if they'd like to do that. You should allow time for getting ready, the operation itself, for recovery, which takes place in the special recovery ward, and then return to the ward. Your relatives need to be reassured that sometimes things take longer, but if they do, it doesn't mean that anything's gone wrong, and in fact this is very unusual. Many people ask about the sort of pain that they're likely to experience after surgery. There have been many progressions of pain management in recent times. It's fair to say that in general terms, pain is minor after surgical procedures, and after some it is minimal. We are experienced in relation to the type of surgery that is done for you, and we know what pain level to expect. There is of course individual variation. We will anticipate your pain needs as best we can. This often means that you'll be given pain medication at the time of the surgery. We will sometimes infiltrate local anaesthetic around the nerves that supply the foot or the knee, and this will help you with pain afterwards. We will use ice packs regularly, and this will help you. Your job is to make sure that the nurses understand that you do have pain, if pain is present. You should not expect that they know that you have pain. They will normally ask you, but you can't be certain that they know your own pain. So you should tell them. And if you keep it to yourself, it's very much to your own detriment. I will see you usually in the hospital after the surgery. However, if I have a very busy operating list, or if I have a long case to do, I may not be able to see you. You will nonetheless receive instructions as to how you should perform in the time after the surgery, and you'll be given a time to see me again. If I do see you, you may find that you don't remember what I tell you, and this is common, as you will have received anaesthetic agents that tend to make your memory a little hazy. This is why we make the trouble of giving you printed material, and also why we've gone to the trouble of making this DVD. You will also be given pain-relieving medications, and you'll be given a prescription for stronger medication should we feel that it will be necessary. An appointment for your post-operative visit will either be made by the nursing staff on the ward, particularly at National Capital Private Hospital, or you'll be given instructions as to when such an appointment should be made and how to do it. You must remember that after your surgery, you may need help with very mundane tasks, such as doing the shopping, driving, and simply moving about. You may not be able to drive for a while, particularly if the surgery has been on your right leg. You will need to rest, and this involves rest and elevation of the foot in question. You may also need some special precautions that may relate to the use of blood thinning agents if you've perhaps had a clot in the past. You are not permitted by law to drive for at least a 24-hour period. After the surgery, we will normally see you between 7 and 10 days later. If we wish for you to have physiotherapy, we will help you organise that. Most of the time, however, we will sufficiently show you the exercises, and you'll be given this DVD, and you'll understand the exercise program that is necessary. Sometimes it is useful to book in to see the physiotherapist on the day after your surgery, and I will do my best to make sure that you're aware of this. Dressings need to be maintained after the surgery. In certain types of surgery, namely knee arthroscopy and ankle arthroscopy, we will ask you to take the dressings off yourself in about 36 hours. The superficial dressings will have underneath them a small sticky area, and this can be left in place and the area can be showered. You should not immerse the limb underwater during that time. At the 36-hour post-operative mark, the wounds are normally dry and the wounds are sealed. If they're not dry, it is wise to dry them off with a small piece of tissue paper and then apply a band-aid. Once again, the wounds can be showered in this context, but not immersed. In other types of surgery, namely knee and ankle reconstructive surgery, we may ask you to remove the dressings 3 days after the surgery. Once again, you'll be given instructions for this, and after these dressings are taken off, you will be able to wash the area with a shower, but once again, not to immerse the area. If you go home with a brace or a boot, we will give you instructions as to how to care for this. But in general terms, if the boot has been applied, we will ask you to leave it in place until we see you again, unless of course there are specific requirements. After foot surgery, the dressings will, generally speaking, remain intact. This would include particularly surgery of bunions and lesser toe deformities, and it is important that you do not take these dressings off yourself. They will be changed when we see you in the office, usually between 7 and 10 days after the surgery. After the surgery, our nurse will contact you, generally between 1 and 3 days after the surgery. This is a good time to ask additional questions, and she is very experienced and will generally understand your requirements. If you think that there are serious problems, then you should contact us, and in daytime hours, this is by ringing the office on 6253 3388. Out of hours, if you think there are serious issues, you will often have the number of our nurse, and you can call her. If that's not possible, or if something urgent is occurring, then you should go directly to your local hospital, or you should ring the hospital where you had the surgery. The hospital number for National Capital Private Hospital is 6222 6666, and Calvary Hospital 6201 6111.